I'm Colin Receiver. Thanks for watching the Patient Attraction Podcast. Now let me ask you a question. When was the last time you saw an orthopedic surgeon advertising a special offer? I'll tell you when. Never. Because orthopedic surgeons are the elite of the elite, and they expect to command hefty fees for their work, even for relatively minor procedures. Now, that's not to say that a patient couldn't price shop among surgeons, but that hardly ever happens. What I'm getting at is that those doctors recognize the value of the services they provide, and they charge accordingly. Now, dentistry isn't orthopedic surgery, but dentists are also an elite group. So why don't they act like it? That's always puzzled me. If you don't recognize the value of what you do and charge accordingly, you're selling yourself short. If you see yourself as a commodity provider, you'll earn a lot less than you could. In almost any given market, some 20 to 30% of dental prospects have the ability and the willingness to pay more for the right dentist. Now, it's true that some markets just won't support a premium pricing, so to speak. But those are the exceptions rather than the rule. The road to better patients and more money begins with you. If you've been running a volume-based dental practice, you've got to make the decision to evolve or not. And that begins with assessing what you offer to your patients. Now, not just the services, but also the experience that you provide while they're communicating with or inside your practice. Better patients are motivated more by the relationship that they establish with your practice than by the financial concerns. And once you've zeroed in on the unique value that you offer, you need to communicate that in every aspect of your marketing. And that's not an easy thing to do for dentists who are used to advertising low price. Your website will almost certainly need a rewrite. Your social media and blog will have to adapt to this new approach. And any offline advertising, such as newspaper ads or postcards, must include some mention of the advantages that why they're choosing you. That applies even if you continue advertising low price for a while longer. And like I said, it's not easy for a traditional GP insurance-driven practice to embrace this new marketing approach. Everyone in the practice is busy, and there's a lot of time for all the writing. Not to mention all the planning, search engine optimization, and other work that goes into a new marketing strategy. Most dentists will do better to outsource their marketing and focus on delivering world-class patient care. That's what Dr. Gilbart from Maryland did. He said, quote, "I've had different companies in the past, and they're good at this or they're good at that, but they don't put it all together. I don't have the time to put it all together. I want to focus on my patients and focus on what their needs are. I like to tinker with the stuff, but to be honest, I'm not that great at it. So I wanted to find a company that could do everything as far as marketing for me. I decided to make the leap of faith, and I'm glad I did. I've been very happy with SmartBox and their ability to take all the pieces and put it together and handle that aspect so I can focus on my patients." Now, SmartBox helps dentists attract the patients that they want, better patients. Our industry-leading patient attraction system positions dentists as the doctor of choice to the patients that they want to attract. Get started by visiting smartboxdentalmarketing.com and setting up a phone call with us. We'll discuss your goals, capabilities, and your market area, and after the call, we'll send you your patient attraction roadmap that's customized to your practice. What you do isn't a commodity business, so you shouldn't treat it like that. We'll help you get the patients you want so you can work less and earn more. Join me for our next podcast. Until then, keep moving forward.